Hey guys, good morning, good evening, whatever time it may be when you see this video. I'm Shanae Starnes, and today I want to talk about the 411 of enrolling in healthcare. This information today will simply be packed with a lot of information, um, just vocabulary, some needed I think touch points that I get people that ask me a lot of things during open enrollment, and we still have some time left. We'll talk about what open enrollment means, and just a lot of good stuff. So I'm going to remove myself. Again, I'm a licensed health insurance agent, and I am here to help empower, enroll, and educate my community and those that are in need of securing health insurance so that they are going to have coverage when they need it and not need it and not have it. So again, I am going to move out the way, pull up my presentation for you guys, and let's get into it. Again, affordable coverage 411 is what we're going to talk about today. So while some people are like they're already disposed to illnesses, and others they like to protect themselves from the unknown. Like there's just different types of people that I run into, but having that health insurance that you can fall back on in either case is like important, right? The biggest challenge that many people face is really who's going to pay for those challenges should you have a health insurance cost, right? So most businesses, we know there's workplace coverage. They offer insurance plans for their employees and families. However, you may feel that you need to get your own personal insurance, especially if you're in a position where your employer does not offer insurance. And if you're self-employed, then your insurance is already left to you. And so that's where I may step in and be able to assist or help you navigate what that looks like. But how do you choose which plan might be best for you? The first thing that you always want to determine is, what is your pocket saying? Like, what does your pocket say that you can afford, right? The two main things to consider when making an effort to identify affordable insurance is what you can afford for monthly premiums, and we'll get into what a premium is, and if you can afford high deductibles at the beginning of each year. So determining if higher monthly premiums will work for you, right? So plans, which are health insurance plans, because that's what you're purchasing when you purchase a health insurance. It's like purchasing your auto insurance plan, except this is called your health insurance plan. So a plan that offers higher monthly premiums, they usually cater to people who have consistent financial responsibility on a monthly basis. So for example, if you're married with kids and you've been employed in the same job for a number of years, you could do well with the type of plan that offers higher monthly premiums. In such a case, it could mean that you'll have the kind of monthly income that could support it, right? The greatest benefit of choosing a plan with a higher monthly premium is that you can avoid being subjected or subject to high deductibles, and you wouldn't encounter the challenge of finding a lump sum payment in the event of an illness. So that's pretty much like a benefit of, having that higher premium when you're paying it monthly, right? On the other hand, you may feel more comfortable with an insurance plan that has a higher deductible and a lower monthly premium. And deductibles, they actually refer to the amounts that are required as upfront payments by the insurance company prior to them paying out your claim. So another example, go back to your car insurance. Every car insurance plan that you have has a deductible. When you have an accident or you have to use it, you have to pay that deductible first before the insurance company pays. Same thing that happens with health insurance, right? So high deductible plans, their plan options, and they're ideal for people who may not have the monthly income to support a plan with higher monthly premiums, right? Plus, if you are rarely visiting the doctor, then your health insurance can protect you from a financial catastrophe in the event of a sickness while saving you money the rest of the time. So in this particular instance, thinking about keeping an emergency fund to pay for expenses until you meet that deductible could be wise. And I just had a conversation with an individual that understood just this. They opted to say, hey, I'll go with a higher deductible plan because I'd rather have a lower premium to pay each month because I'm rather healthy. Although we know insurance is about risk, but they said, you know what? When I went over the plan with them, they said, well, I'll just put some money aside in the event of, something possibly occurring, right? And so having that base knowledge is very important. So typically having a plan with a lower deductible just means that you're going to be like, maybe not seeing the doctors as much throughout the year, and the additional expenses that come with the emergencies and any type of lab test will not be as let's see, let me make sure I'm reading that correctly. Typically, having a plan with lower deductibles just mean that you're more flexible throughout the course of the year to make doctor visits, take the routine tests, and even deal with additional expenses that come with the surgeries and the lab tests. And that's important for some people, right? All right, so now let's go ahead and get into how does healthcare insurance actually work. So health insurance works by providing a financial protection against the cost of medical care. So at the end of the day, it's really about protection. Any type of insurance, I don't care which insurance that we're talking about, it's always about protecting something, right? In this instance, it's protecting your health, and what you may run into. So here's a simplified explanation. So I talked a lot about deductibles and premiums, but let's break down some of that vocabulary. The first thing to talk about is really, what is a premium? The premium is what you're going to pay. It's a regular monthly fee that's called a premium, and it's paid to your insurance provider each month. Okay. Coverage, you hear that term being used a lot, coverage. So in return, the insurance company helps cover your medical expenses, and this includes your doctor visits, hospital stays, medications, and preventative care, depending on the type of plan that you have. All right. And let me just say, it helps cover. A lot of times people feel like they have health insurance and they feel like everything is covered, but it helps to cover. And we'll get into that as well. Deductibles. What is a deductible? Before the insurance kicks in, you'll often need to pay a certain amount out of your pocket, known as a deductible. And once you reach this amount, the insurance begins to cover the cost. Then we go into understanding co-payments and co-insurance. Using that prefix co usually means two. It's you, and then it's the insurance company. A co-payment means that the insurance company is going to pay for maybe that visit to the doctor. You're going to pay your co-payment portion of that doctor visit, but the insurance company is actually paying the other component. And then there's some co-insurance instances as well. So this is where you may still be responsible for a portion of the cost even after reaching the deductible. And this can be a fixed amount, which is called a co-payment, or a percentage, which is called co-insurance of a total bill. And a good example of co-insurance would be the example of you going to the doctor and the doctor says, let's order some diagnostic tests such as your blood work, or they may want to order an x-ray. Well, that's where your co-insurance would step in, depending on the percentage on the plan that you've chosen for the year. You may get a bill in the mail because your portion of the bill is where you're going to pay 20% of that bill, and the insurance company is paying 80%. So that's where co-insurance would step in. The co-payment stepped in when you went to the doctor to visit. You paid your $25 to visit the doctor, but that entire visit to that doctor normally is $100. Okay, so those are examples of co-payments and co-insurance. Networks. So insurance plans often have networks of healthcare providers. Staying within the network can reduce your out-of-pocket expenses. And this is important because you have to know what type of insurance plans that you have, because if you're with a workplace coverage, meaning that you're at a job, you still want to find out if that company has depending on what type of plan you have, do you have to stay within a certain network? Do you have an option to go in between different networks? If you don't know that, and your plan actually allows you to stay within one network only, and you go into a network that's not covered, then you will be billed for that. And you have to know that in order to avoid that mistake. That is really something that is on you, the individual, because you're not aware of how your plan works. So this is where understanding how networks work and you inquiring and making sure that you understand is going to be important. Preventative care. Many plans cover preventative services at no cost, and this could include vaccinations, screenings, and wellness checkups. And, really, healthcare is really about us staying in that space of preventative care. And a lot of times I hear people say they haven't gone and got a test like in years, or they haven't gone to see the doctor in years. And so there's no way to stop something that may be going on because you've never had a chance to even see if anything was going on, or to say, hey, I've had a clean bill of health for years. There's nothing brewing in my blood work or any of those types of things. So there's no scientific data to show either way how healthy or unhealthy you really are. So let's say by the time you are sick, you may be in a later stage of your sickness than you could have been had you just gone and just took care of some free, maybe, I'm not going to say free, but did some preventative care visits before your visits became diagnostic care. And that's going into a lot of detail, but just a real quick, simplified explanation of some terms here for you. Now, why do we need it? I don't really try to sell this part too much. I like to share, but why do you need it? I'll cover why. I think that, and I know that even behind here on my banner, it says the biggest financial risk is your health, but the largest financial risk is your health. Some may differ from that, but I tell you what, you can't make any money if you're not here to make money. You are an asset to your company. If you work for someone, you're an asset to your family. When you're here, you're an asset to everybody. You're an asset to yourself, just living and breathing, right? So your health is important to anything and everything. So the financial protection, number one, your health issues can be expensive. Insurance helps to protect you from the potentially high costs of medical care. Also, it's important to have access to care. That's why people try to get health insurance. They try to file for disability. They try to get Medicare. They try to get Medicaid. They try to get these state-funded insurances because they know that if they don't get themselves well, then the next route is on their way to death, right? So the whole thing is to prevent and to have a long life of living if possible, right? So having access to care is huge. So having insurance provides you with access to network of healthcare providers, ensuring that you can receive necessary medical attention when needed. Preventative services. Insurance often covers preventative services, helping you stay healthy and catch potential issues early. And legal requirements. In some states, there's still a legal requirement. I know here in North Carolina, if your child is in a state college here, there is a requirement that you have health insurance available for your child. Or there may be a situation where, for child support purposes, it may be a legal requirement for you to have health insurance on that child. So health insurance could be a legal requirement, and not having it may result in some penalties, right? And then just for the plain peace of mind, right? Knowing that you have coverage can offer peace of mind, allowing you to focus on your health rather than worrying about financial implications during a medical crisis. I can tell you, if you haven't experienced it, maybe you know someone that has had to have a medical situation that really caused the financial strain because we've had to pass around a hat or pass around a GoFundMe page. The GoFundMe ain't always about for the life insurance component of conversation, but it could be just because of like a huge illness that has stricken a family or an individual, people that we love, and they need help, right? So here are 5 things to consider before the enrollment deadlines, right? So whether you're at your job, whether you get your coverage in the marketplace, or whether you get your coverage through Medicare, there's always these deadlines, right? So here's some things to think about when you're getting healthcare through those means. Don't forget, know your open enrollment start and end dates. And for example, if you qualify and select coverage from the marketplace, the open enrollment dates are from November 1st to December 15th if you want a January 1st coverage start date. But again, know those dates. I talk to a lot of people and they may not even know the dates at their workplace of when their open enrollment starts and ends. That's very important because you don't want to miss it. You don't want to go without coverage, right? And ensure that you've reviewed and selected your health insurance before the cutoff date, because you don't want to rush and not get something that you really wanted, but you didn't because you didn't take the time to kind of map out what you were going to get for the year. Also, you want to do like a coverage assessment. Again, take time to assess your healthcare needs. I like to remind people that health insurance is a 1-year contract. That's why you have an open enrollment option once a year. And that's because health insurance, it doesn't automatically renew because every year something could be different. Doctors may switch networks. Companies have options to choose different choices for their employees. Things change. So just know that your health insurance contract of insurance is for 1 year. So you want to consider any changes in your health or life circumstances that might necessitate any adjustments to the coverage for the upcoming year. So you also want to do some plan comparisons. I like to give people options and choices. I like options and choices. I don't like to just be handed one thing. So you want to make sure that you're comparing available plans to find the one that best suits your needs and your money, your budget. You want to look at the premiums. Now that you know what the premiums mean, that's how much you're going to pay per month. Can you afford that type of plan? You want to look at the deductibles. Is it high? Is it low? And you want to look at the coverage details to make a really good informed decision. I like making an informed decision. That's only fair. I think we all need to be able to make informed decisions, right? Prescription coverage. You want to make sure that the type of plan that you choose covers the essential medications, and make sure that whoever you're working with takes the time to go through the formulary so that they and you can avoid any surprises when it comes to prescription costs. Like, I still have to go through and get the list of medications to let a customer know what that cost would be, because I teach and tell the clients that with prescriptions, they are on what's called a tier level. So it's easy for me to say, hey, your generic drugs are XYZ, when that particular drug may not be a generic drug. It may be a specialty drug. And then when we dig into the weeds of things, that particular coverage may be meaning that they're going to pay 50% and the insurance company may pay 50%. Well, that could be 50% of 300. So those are surprises that a client does not need when they are in need. And laying that out in the beginning so that they can make an informed decision before they choose the plan is important for me to convey to the client, and it's important for the client to know. Provider networks. We talked about networks a little earlier. You want to make sure that you double check if your preferred healthcare providers are in the network of your plan choices that you're considering. Staying in network can help minimize out-of-pocket expenses, because remember, if you have a particular doctor that you like to go to and they're not in network, but you still want to go to them, then that means that's going to be out-of-pocket expense. And here it is, you're paying a premium for doctors that are in a network, but you have this out-of-network doctor that you're going to be creating an additional expense for, right? And so, like, for an example, I said to one of my clients today, I said, listen, we want to make sure that one of her providers is in network with a carrier that we're going to choose this year. And I told her we'll call back. I'll get with her tomorrow because we need to make sure. I'd rather her make sure because I know that's important to her, right? So provider networks are key, and it's about money, making sure that you're not spending any additional money unnecessarily, right? So now in this part of my presentation, I wanted to go through like what are summary of benefits, because I went over what I just talked about just now, but sometimes people don't understand it and it doesn't make sense. But when you get your insurance cards, your carriers usually send what's called a summary of benefits. And I'm going to go through what is on a summary of benefits, right? And here are some things that you want to make sure that you jot down for yourself. And this is going to be summary of benefits part 1. And at the top, these are going to be important questions, answers, and why this matters. That's what's going to be on the columns, right? And we're going to cover what goes across the bottom on the row. And let me see if I can make this a little bigger because I can't see this. Oh my goodness. Okay, here we go. All right. So, summary of benefits. So again, on this page at the very top, across the top, there's the rows, right? You have important questions. You got answers and you have why this matters. It's a lot of stuff, right? So I'm going to help navigate this very quickly. On this plan, it's what is the overall deductible. So you want to know what the deductible is. Okay, the overall deductible is $500. And why does this matter? It matters because you must pay all of the costs from the providers up to the deductible amount before the plan begins to pay. All right. Now the 1,000 is if you have yourself and someone else on the plan, like a family plan. All right. So know that that's an important question for you to know. Is there a deductible and what is it and what does the deductible pay? Now, the next question under the column of important questions, are there services covered before you meet the deductible? This is yes. All of the preventative care visits are covered and primary care services are covered before you meet the deductible. What does that mean? That means that you can go to the doctor and schedule a mammogram because that's a preventative visit and don't have to pay them to meet the deductible. You could go to the doctor and schedule, let's say, a preventative colonoscopy, like anything that is going to be labeled a preventative care visit, then you don't have to meet the deductible in order to do so. That's what that means. Now, underneath that section, are there other deductibles for specific services? This is important to know. Some plans say no, and this one says yes. This one says yes because there is a $300 deductible for prescription drug coverage. So that just means, and we haven't gotten there yet, but on this plan for prescription drug coverage, there's a $300 prescription drug coverage deductible and a $300 deductible for occupational therapy services that need to be met first before whatever the service is going to pay after that, which I'll find out once we go down the services. What is the out-of-pocket limit for the plan? So out-of-pocket limit means that what is the maximum amount out of your pocket will you have to pay for the year? Remember, I told you healthcare plans are for 1 year. So what is the out-of-pocket maximum plan that you will have to pay? For network providers, individual, you would have to pay $2,500. In many cases, you may not have gone to the doctor enough for the year for you to even meet that. But you still need to know what that looks like. $5,000 for the family. In this case, you do have out-of-pocket coverage on this plan where you have $4,000 as a max out-of-pocket and $8,000 for a family. And let me just back up and tell you what type of plan this is. And it's up here to the right. And it's a PPO, which is a preferred provider option. And that just lets you know when you hear PPO, that means that you have a plan that goes between in-network and out-of-network. But when you go to an out-of-network provider, you're still going to pay higher amounts than you would if you stayed within the in-network providers that have a contracted relationship with the insurance company. Let's see here. Let me go here because I can't see. All right, so let me go down here a little further. Now, will you pay less? Okay, I just explained, will you pay less if you use a network provider? And the answer is yes. Then it tells you here also, and this is all your summary of benefits, do you need a referral to see a specialist? And the answer is yes. And it tells you under why this matters, that this plan will pay some or all of the costs to see a specialist for covered services, but only if you have a referral before you see the specialist. That's, again, important knowledge for you to know so that you know how to operate and utilize your particular plan. All right, moving right along, almost done. Here we're going to talk about summary of benefits part 2. And this is where we're going to talk about the common medical events, services you may need, what you will pay in and out of network, the limits, exceptions, and other important information. Let's get into it. All right. So again, follow right along at the very top across the columns. That's where you'll see the common medical events that we're going to talk about. These are things that actually happen, what happens when you get there, what services that you may need when you have this common medical event, what will you pay, and what are some of the limits, exceptions, and other important information. So let's start with the first column. So if you have a healthcare provider office or clinic visit, the services that you may need when you get there is to be treated for an illness or an injury. And there, if it's in network, then you're going to pay $35 co-payment office visit. Okay. And if it's outpatient, it'll be a 20% co-insurance. You do not have to meet the deductible in order to utilize this service, is what this is saying. And this is if you visit the doctor. If it's out of network, just know these are the percentages over here. I'm not going to talk much about the out of network. Just know it's higher, but you can have access out of network on this particular plan, but everything is a little higher. There's no limits on the plan of any sorts. A specialist, you can go to the specialist. The doctor says, hey, you need to go to a specialist. Your copay will be $50. A pre-authorization under the limitations and exceptions is required. If you do not get the pre-authorization, benefits could be reduced by 50% of the total of the cost. Again, preventative care screenings, there are no charge. That has this here. That's if you go to your provider. If you have a test, the doctor says, hey, we need to order x-ray, blood work, then that's a $10 copay for the test. If they say, well, we're going to do a CT, a PET scan, or an MRI, that's a $50 copay. If you need drugs to treat your illness or a condition, then Tier 1 generic drugs will be $10 as your copay. Tier 2 would be $30. Tier 3 would be 40%. Tier 4 would be 50%. But once I get to that particular level, we would go in here and put in the, excuse me, the prescription drugs, and we would be able to decipher where that particular drug falls within the formulary so that the client would know up front what they're looking at, right? If you have outpatient surgery, then for the facility fee, it would be 100 a day. For the physician surgery fee, it would be 20% co-insurance. If you need immediate medical attention, emergency room fee would be 20% co-insurance. If you need emergency medical transportation, 20% co-insurance. And then if you needed to visit urgent care, it would be a $30 copay. And then if you had a hospital stay, it would be the faculty fee would be 20%. All right. Getting down here to the very last screen here. And let's continue talking about if you need mental health, behavioral health, or substance abuse services, any of your outpatient services, you have a $35 copay. If you are pregnant, it does. Oh, inpatient. Let me go back. If your inpatient services are needed, you have a 20% co-insurance. If you're pregnant, the office visits are 20%. Childbirth, professional services, 20%. Childbirth delivery facility services, 20%. And just looking over here to the side, there's some cost sharing that doesn't apply to certain preventative services depending on the type of services. So that falls under the pregnancy, right? If you need help recovering or have special health needs, we do have some home health care, some rehabilitation services, some habilitation services, some skilled nursing services, some durable medical equipment, hospice services. They're all 20% co-insurance. And respectively, it does tell you what the limits, exceptions, and other important information are in the very last column. And then hospice services as well. And then if you have a child on the plan and they need dental or eye care, it does share here. Also at the bottom here, there are areas where there are some excluded services and other covered services that I usually try to get covered. I don't know if you've heard, like on some of my other videos, I do talk about, some of the most popular questions that I may get are, the weight loss surgery or the mental health. People ask about those types of questions on the healthcare plans, which are very important, and they're important to the people that are needing them. So I just wanted to tell you that I appreciate your time. I wanted to stay within about 30 minutes because for me, it's about, if you need information, let me know if I can help you. Again, I am a licensed health insurance agent. I do many things, but this is one area that we're in right now, and people need help. They need services. My website is ShanaeStarnesAgency.com. If you'd like to schedule some time to get enrolled, or maybe you know someone that needs the services, I'd be more than happy to assist them, help them, get them in the right direction. In particular, we have 5 days left in open enrollment for the marketplace. I am a licensed agent in the states of North Carolina, South Carolina, Virginia, Alabama, North Carolina, Indiana, Florida, and that's all I could think of, and counting. So if there's anything that I could do to assist maybe yourself or someone that you know and you love, I really don't mind helping. But with that being said, be very blessed. And again, that's the 411 on enrolling in healthcare. I hope that was beneficial to you, and be good. Until next time, peace.